number one risk factor for breast cancer is being female, right?
Yes.
Because we produce a lot of estrogen. Now, inactivity, lack of regular physical exercise, this is a modifiable risk factor. So those ladies out there, if you're not exercising, then you need to start doing so. 30 minutes a day at least will decrease your risk for breast cancer. Now, diet. It seems as though every disease that we can think of, every chronic disease, the number one risk factor there is poor diet. Now, we're living in the United States. Why should we have a problem with poor diet? What are we eating that increase the risk for all of these diseases?
Lots of processed foods.
Processed foods.
High saturated fats.
Saturated fats.
You know, just less fruits, less vegetables, less natural, you know, more refined foods and less complex carbohydrates, etc.
That's right.
So, I mean, this is very accessible, and especially in poorer communities, this is definitely what there's a prevalence for.
Right.
Right,
and therefore, Get Health with Dr. Cooper promotes healthy lifestyle habits. Now, I have 2 books on the market. One is 14 Days to Amazing Health. The other is Incredibly Delicious Vegan. So if you're listening to us and you'd like to change lifestyle, you'd like to learn how to increase your fruits and vegetables or move to a more plant-based whole food diet, then get one of my books. You can find it on my website or on Amazon. Now, Dr. Daly, what are the other risk factors that we probably have not addressed?
Well, I mean, we mentioned genetics, dense breasts, maybe a risk factor, probably because the mammogram is not as sensitive when the breast tissue is dense. So a lot of times this calls for adjunctive studies, and because the test probably was not well done or was inadequate, there have been increased cases of breast cancer in those situations. And patients who have dense breasts should be advised that their breasts are dense, and so we cannot, you know, the test is not 100% reliable, and they need to have closer follow-up.
Right. So, ladies, if you're listening to us, if your doctor told you that you have dense breasts, then you need to ask for a secondary study, which could be a sonogram or a compression spot view of your mammogram. Now, another risk factor is radiation to the chest. Yes. People who probably have had lung problem and have
Hodgkin's lymphoma, situations like that where they've had ionizing radiation treatment over a period of time between 10 and 30 years. It's been found that between 10 to 30 years old, it's been found that exposure during that time can increase the risk of breast cancer, and sometimes even later. So, you know, this is something, if you have a history of this, that's definitely something that you need to pay attention to and go in and ask for screening.
Right, right. Another risk factor, you know, many times I have ladies coming into my office and they have hot flashes and they're asking for hormone replacement therapy. Now, hormone replacement therapy is indicated for how long? And why is it that we have to stop the estrogen supplement at a particular time? You want to expound on that a little bit?
Well, yes. There's synthetic hormone therapy, and there's also bioidentical hormone therapy. The synthetics, you know, the Premarin or Estrace or some of these drugs that some of you may be familiar with, have been implicated in breast cancer. There was a study called the WHI study that was done back in the 80s that showed that people who received estrogen and progestin did have an increased risk of breast cancer, so much so that they actually had stopped that study. In patients who have had a hysterectomy and and it's indicated to use progestins if you have a uterus still, because of course that can lead to other GYN-related endometrial cancer if you're using unopposed estrogen. So it is desirable to use both if you're being treated for menopause. In people who have been hysterectomized, they get estrogen. It's actually just estrogen, and it's been shown that they have a somewhat lower risk of developing breast cancer. Right. So the estrogen replacement usually, I mean, they usually start because of hot flashes, vaginal dryness symptoms, etc., it's recommended after that WHI study that the hormones be continued until the symptoms go away, say, especially the hot flashes. So whenever the hot flashes go away, then they recommend that you stop treatment. Of course, that can be a problem in some people who are still having symptoms.
Right.
Yes.
So the recommended duration for hormone replacement therapy is no longer for lifetime, right?
No longer for lifetime. That was initially.
Right.
With bioidentical, they have a different tape, but that's a whole other story.
Another
So we won't get into
another
that.
subject.
Yes.
Okay.
Yes.